Welcome. As you can see, this Pecha Kucha is a program proposal aimed towards veterans who have been involved in combat and had a morally injurious experience. Troops returning from Iraq and Afghanistan have very high rates of PTSD, depression, and moral injury. It is estimated that around 300,000 troops returning suffer from the above factors, both individually and combined. Many soldiers returning stateside express the need to make sense of things they witnessed overseas and sometimes actions they took part in. Both religious and spiritual practices have been deemed as successful in helping individuals confront and make sense of stressful situations. These are not confined to wartime situations, but also helpful for coping with diagnosis of HIV and cancer, accepting problems and death, and overcoming depression. It was found that 90% of people in one sample turned to prayer, religion, or spiritual feelings in response to the terrorist attacks on 9/11. And when asked open-ended questions about what enabled depressed older adults to cope, 40% responded with faith-based answers. Following a traumatic event that someone witnesses, learns of, or experiences, stress-related reactions may occur. When these reactions do not cease over time and begin to disrupt daily life, PTSD is the likely cause. There are three main categories of symptoms for PTSD: re-experiencing, avoidance, and hyperarousal symptoms. These can stem from internal thoughts, cause changes in personal routines in an effort to avoid things that remind them of events, or be generally constant. Moral injury is defined as perpetrating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. Many individuals who suffer from moral injury also talk about feelings of personal failure. Moral injury has also been described as a dimensional problem, as there is no real threshold for establishing that moral injury is or is not present from a clinical standpoint. There are similar symptoms to PTSD, but symptoms unique to moral injury are shame, guilt, and demoralization. If one is not able to grasp events within the context and environments in which they occurred, avoidance problems have the potential to develop. The longer an individual continues to live with moral injury, the more likely they are to begin feeling as if they are immoral or irredeemable. The objective of a spiritually based support group would be to foster and repair moral injury in veterans by embracing spirituality in connection to others, utilizing exposure therapy and a figure of benevolent moral authority. This intervention would take place once a week in 2-hour blocks over the course of 16 weeks, with 8 specific biweekly action steps, purpose, and goals. These are outlined in the next few slides, although the presentation may need to be paused for closer examination. For the first 7 weeks, a therapist would meet with each person in the group on an individual basis. This is to ensure that a trusting relationship is able to form and help each individual begin to learn how to verbally discuss issues and struggles they are facing. These sessions would be conducted privately. During the 8th week, everyone in the support group would meet in a group setting and continue their sessions with the group as well as the therapist. These sessions would need to take place in a larger room where all participants could face each other in a circular fashion. A minimum of 1 clinical therapist with experience in traumatic events would be needed. No additional training would be necessary unless therapists had not previously been introduced to the concept of moral injury alongside spirituality or worked closely with military professionals. Therapists are also encouraged throughout the 16 weeks to establish conversation about spirituality and transcendence. Throughout the program, it will be reinforced that individuals are not defined by morally injurious experiences and that mindful and purposeful experiences will help them to reconstruct the self. For pre and post support group evaluation and comparison, the HOPE tool will be given as a spiritual assessment by the therapist. There are no numerical values associated with this assessment, but would need to be evaluated qualitatively based on verbal response and change in spiritual insight. The HOPE assessment was initially developed for primary care physicians as a formal spiritual assessment in a medicalized setting. For the purposes of this program, some alterations were made to make it more relevant to veterans and moral injury. Studies have shown that veterans who were engaged in daily spiritual experiences and practiced prayer or meditation regularly endorsed greater levels of forgiveness or were engaged in a church or other community all showed lower levels of PTSD symptomology. Higher levels of social support have been shown to help promote self-efficacy perceptions in war veterans, which resulted in lower distress and more efficient coping strategies. High levels of religious and moral beliefs also help mental stability by controlling distress. By incorporating spirituality into a support group, it is hypothesized to help foster healthy relationships, open communication, and connect individuals suffering from moral injury who hope to overcome it and rekindle their deeply held moral beliefs and expectations of themselves and others.